Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, May 5th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen, and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you for joining Dr. Hanley, Mary, and myself today on the traditional territory of the Kwanlin Dun First Nation and the Don Quachin Council. As always, we are happy to be here with everyone safely watching from their screens to provide you with the weekly update. I want to begin by recognizing that this is Mental Health Week. We know that people are experiencing an unprecedented amount of stress and anxiety related to COVID-19. The theme of this year's Mental Health Week is understanding our emotions. Naming, expressing, and dealing with our emotions, even when they're uncomfortable, is important for mental health and can help us feel better. This Mental Health Week is an important, and the hashtag #GetReal is all about how you are feeling. You will see various posts across social media urging us to name it, don't numb it. And I couldn't agree anymore. You might already know how important this topic is to me. In March, the Canadian premiers launched a podcast about promising practices in mental health and substance use. I'm very proud to say that Yukon and Saskatchewan led this initiative, and I included some of my own examples and insights in our very first episode of the podcasts. Now more than ever, I believe we need to talk about our mental health and how to normalize our struggles. We need to learn from each other as we continue to adjust to new realities with long, lingering impacts. And remember, for those of you in need of mental health supports, you're not alone, and resources are absolutely available for you. The mental health and wellness hubs continue to provide services throughout Yukon, and counseling services are available over the phone by calling 1-866-456-3838. I want to thank all of the mental health workers who are working to support Yukoners throughout the territory. And I want to thank all Yukoners who take the time to check in on friends, on colleagues, neighbors, and family members. Keep it up. It really is the difference to do so. It's not only Mental Health Week, but you may be able to see the stunning pin, the red dress pin that I'm supporting today. This is a gift from Yukon Government's Aboriginal Employee Forum. I want to thank Cheyenne Kaiser at Aboriginal Employees Forum member, an employee with the Department of Health and Social Services, for this beautiful pin that she handcrafted herself. This pin is one of the ways that I'm participating in the National Day of Awareness for Murdered and Missing Indigenous Women and Girls. Métis artist Jamie Black first introduced the symbol of the red dress through the Red Dress Project, and Dr. Hanley also has a handmade pin on as well, and he'll talk about who made that one. But for the record, Mary is wearing a pin that Mary designed or built herself, which is very cool to see as well. To pay homage to the original project, the Aboriginal Employees Forum is displaying its own red dress installation outside of the main administrative building here in the front courtyard. The empty red dresses signify the loss of thousands of Indigenous women and girls and 2S LGBTQIA and plus people to violence. I encourage all Yukoners to learn more about this initiative and to read Yukon's strategy for murdered and missing Indigenous women and girls and Two-Spirited Plus people called Changing the Story to Upholding Dignity and Justice. Thank you for that, folks. Now on to the COVID updates. I must thank Yukoners again for all of their efforts to help the territory stay safe, strong, and healthy. We have one new case since last week. The individual took all the proper precautions, and there's no risk of exposure to other members of the public. It has been heartbreaking to see what is happening to our close neighbors in the Northwest Territories just the past few days. Our hearts go out to our friends and family and colleagues in the Northwest Territory. With the school outbreak and the facilities shutting down there, this is a reminder that we must continue to stay on guard and practice the Safe 6+1, encouraging vaccinations and exercising patience and understanding. We really are fortunate to be in the position that we are in, and it is no small thing that Yukoners can still have a meal at a restaurant, for example. As of May the 3rd, 74% of eligible Yukoners have now received their first shot, and 65% have received their second shot. The nation's eyes are on Yukon. Thank you very much. This is great news for our territory, and it's great news for our country as well. And it's a significant accomplishment that we can all take pride in. The success of our vaccine rollout means that we are closer to being able to lift restrictions here in the territory. Today, I'm excited to announce that we plan to adjust travel restrictions in the coming weeks. As of May 25th, people who are fully vaccinated will no longer be required to self-isolate for 14 days upon entry to the Yukon, provided their vaccination status can be confirmed. I know that this will be welcome news to Yukoners who have been patiently waiting to visit with family members that they have not seen for months. We still need to take precautions to protect against the spread of COVID-19 and in particular variants of concern in the territory. As a result, those individuals whose vaccination status cannot be confirmed will still have to isolate for 14 days upon entry. As we move into the spring, we are once again seeing an increase in travelers heading to or through Yukon, thanks to the measures taken by our government, together with our federal partners at the Canadian Borders Services Agency and Public Health Agencies of Canada. We have been very successful in mitigating the importation risk of COVID-19 from such travels. To put things in perspective, there has been no known cases of COVID-19 linked to the estimated 20,000 plus individuals who have traveled through Yukon to or from Alaska since the beginning of the pandemic. Anyone entering Yukon is required by law to fill out, sign, and submit a declaration form which outlines their recent travel and their self-isolation plan. These declarations are collected at the Whitehorse Airport and at the border information stops near Watson Lake. All flights are met upon landing in Whitehorse, and the border information stations in Watson Lake have once again increased their operation hours to 18 hours per day, 6 a.m. to midnight, to meet the rising number of travelers. 'Tis the season. Over the winter, the Public Health Agency of Canada and the Canadian Borders Service Agency introduced much stricter public health measures that support our government's efforts to keep Yukoners safe from COVID-19. Non-essential travel to Canada remains severely restricted, meaning that travel into or through Canada for tourism, recreation, and shopping is not permitted. In addition, anyone entering Canada, whether they are planning to stay or are in transit to or from Alaska, must now provide proof of a valid negative COVID-19 test result from the previous 72 hours before they are permitted to enter Canada. Travelers are tested again upon entry to Canada and during their following self-isolation or transit. For travelers in transit to and from Alaska, a hang tag is now issued, which enables enforcement officers to identify who should remain on the travel corridors. The travelers must strictly adhere to public health guidance, avoid making any unnecessary stops, wear a mask outside their vehicles, and practice physical distancing at all times. On Yukon's highways, we are redeploying signage to remind travelers to remain on the highway corridor complete their transition within 24 hours, and to travel respectfully through the territory. The Government of Yukon's CIMA Investigations Unit continues to investigate complaints and CIMA infractions, including any reports of travelers who have strayed from their approved travel corridor. Here in Whitehorse, Bylaw Services work full-time and side-by-side with our investigators, assisting with investigations and regular patrols to monitor the presence and compliance of out-of-territory vehicles. In the past week, 7 new charges have been issued under the Civil Emergency Measures Act. 4 of these were for failure to self-isolate as required, 2 were failure to provide a declaration, and 1 was for failure to transit through the territory as required. I want to thank all of our partners across the territory who are helping with our enforcement efforts. We will see more travelers in the coming weeks, and it is important that we treat them with respect. If you have concerns, please call the enforcement line. That number is 1-877-374-0425, or email covid19enforcement@gov.yk.ca. As we look to loosen restrictions, testing will continue to play a critical role in keeping our territory safe. Now, Dr. Hanley and I have been asked numerous times how Yukon is using rapid tests, and we've been provided by the federal government. In recent weeks, we've begun implementing point-of-care testing using the Abbott ID Now devices in select locations. Currently, we're doing so through occupational screening for essential workers who must travel consistently for work purposes. This has included the screening of flight crews as well as out-of-territory healthcare workers to reduce the burden of self-isolation on these individuals who are consistently traveling. We hope that in the future we will be able to use this point-of-care testing to identify cases that are hard to reach with routine testing programs, implement rapid preliminary testing capacity in remote and rural locations, as well as rapidly characterized potential outbreaks through proactive screening. We continue to explore which areas would benefit from implementation of rapid testing. As of right now, Dr. Hanley and his dedicated team are closely assessing the implementation of these devices within mines and also rural communities. It's also important to remember that rapid testing is not a foolproof strategy, as test accuracy is not perfect. We know that the incubation period of COVID-19 is 2 to 14 days, meaning that a rapid test for the general population is not a sound idea at this time. Testing works best when someone is symptomatic, which is why I continue to encourage you all, even when you are vaccinated, to seek testing if you have COVID-19-like symptoms. Seeking testing when sick is a key part in reducing possible transmission and spread. Testing will continue to be vital as we move forward. In addition to loosening the traveling restrictions, as of May 25th, bars and restaurants will also be able to return to full capacity for indoor table service. I want to thank each and every one of our local restaurants and bars for their hard work over the past year to adapt to the restrictions that we have put in place to protect Yukoners. Your efforts will soon be rewarded as you will be able to welcome more patrons to your establishments. Now, Dr. Hanley will have more to share about these changes in a moment. We have a lot of work to do in the coming weeks to prepare for these changes. We would not be in this position without the many sacrifices that Yukoners have made over the past year and your willingness to get immunized. I encourage all Yukoners who have not yet received their shot to book an appointment. I also encourage people to speak with your friends and your family to encourage them to get their shot if they have not done so already. The vaccines are saving lives. The more people who receive them, the safer we will be and the sooner we will be able to return to a more normal way of living. Hallelujah. The clinics here in Whitehorse is still booking appointments for first and second shots, and they are accepting drop-ins during the weekend, during the weekdays. You can book an appointment online at yukon.ca/thisisourshot. You can also phone 1-877-374-0425 if you need assistance. Thank you very much, everybody. Thank you for your patience, for your vigilance. And again, as I like to end this every time, be kind to each other, look in at each other, and just keep on being Yukoners, because that's why we are in the situation we're in right now, is because of your due diligence. Thank you very much. Dr. Hanley.
Thank you, Premier Silver, and good morning, bonjour. And first, I want to thank Angela Saleh-Roche for the red dress pin that I am now wearing. And thank you, Angela, and thank you, Ronnie Sue Sparvier, for presenting this pin to me just before coming here. And Ronnie Sue also works for Yukon government and is herself wearing a stunning red dress and pendant, which was a gift to her. 1 year ago today, I sat in this same spot and shared with Yukon Public that we had no active cases of COVID-19 in Yukon and that we had only 11 confirmed cases up to that time. At that time, I credited our ability to keep our numbers low, in large part to the fact that people were seeking out testing when they had symptoms, that we could carry out effective contact tracing, and that people, by and large, were following the public health measures and guidance. 12 months on, we have had 82 cases, with just one active case currently. 12 months on, we have had no community spread. And still, we can credit our success to Yukoners' faith that the Safe 6+1 will help protect them, to our ability to test and to carry out efficient and effective contact tracing, and to people doing what they need to when identified as a contact, when traveling into the territory, or when becoming a case. 1 year ago, I said the following: we will definitely get back to a place where we can do all the things we value at whatever distance we choose, and we will get back there on the safest path so that we can all get back there together. Vaccine is now a reality and is boosting our return towards normal. Vaccine plus all these measures that we have in place have brought us to the spot that we are in today, in which we are able to announce with confidence that as of May 25th, individuals who are fully vaccinated and who leave the territory for any reason will not be required to self-isolate upon return to Yukon. We also have to credit those citizens who have done the right thing when testing positive for COVID-19 and those who have self-isolated after returning to the territory. Our most recent case provides a perfect example of following public health measures with care. Because this person did everything that we could ask, this case did not have any contact or crossover with other people. I commend them for being so aware and informed, and because of this diligence, there are no public exposure notices linked to this case, and the person is recovering well at home. Just one short paragraph in French for a soundbite. Les mesures que nous avons en place nous ont emmenés à l'endroit où nous nous trouvons aujourd'hui. À partir du 25 mai, des personnes qui sont complètement vaccinées et qui quittent le territoire pour n'importe quelle raison ne seront plus obligées de s'isoler à leur retour au Yukon. So this is one giant leap in our path forward, as the Premier has indicated. As always, there are details we are working on, such as the verification process for determining vaccine status for both Yukoners and non-Yukon Canadians, but we are getting there. Now, there are also a number of caveats. First of all, we are still in a time when non-essential travel within Canada is not advised, and when many provinces and even territories have travel and other restrictions in place. For example, in BC, non-essential travel between regions is not permitted, although we are hoping that this restriction will be eased in the weeks ahead. The point is that this change in self-isolation requirements is not about an open invitation to travel outside Yukon for your vacation. It is more about recognizing that by the time you are 2 weeks past your second dose of vaccine, your risk of acquiring COVID infection is very, very low. And even if you did acquire the disease, your risk of passing it on to others is also likely to be very low. The risk, in our estimation, and given our high vaccination rates in Yukon, can no longer be justified by asking fully vaccinated people to self-isolate when they travel. The next point is that when people do travel, I'm still asking you to do the right thing. You need to abide by all public health measures in whatever province, territory, or region in which you are staying. You should wear a mask in all settings where you are either required or recommended to. You should avoid parties and social gatherings that exceed the prescribed limits for numbers of people or spacing. Observing all these public health measures will mean that your risk of acquiring COVID infection will remain very, very low. And when you return, even though you do not have to self-isolate anymore, you may still be screened out of higher risk settings, such as the hospitals and long-term care. We will be in a transition period as a society to get to this new place. You should avoid large indoor social gatherings, and as a returned traveler in Yukon, there may be certain premises that will still not accept your entry. Don't assume that you can suddenly make appointments within 2 weeks of travel. Be safe and book for after that 2-week period. But we will gradually work with everyone to clarify the direction and to increase your ability to move around in society. In addition, although not required to self-isolate, you should self-monitor for symptoms and ensure that if any symptoms develop that could be COVID, that you self-isolate and arrange for testing. Also, please note that this exemption does not yet apply to children who cannot yet be vaccinated and who will still need to self-isolate. It also does not apply to those Canadians, including Yukoners, who are not fully vaccinated with a vaccine approved by Health Canada. And we are working on potential alternative options for these two groups, the children and the partially vaccinated. Still, I'm hoping that this good news is going to be welcomed by many. We are only at this point because of all that has come before, the sacrifices that have been made and the restrictions we have faced, and the fact that 74% of eligible adult Yukoners have had at least their first shot and 65% their second. 2 shots plus 2 weeks is going to be the ticket to travel after the May long weekend. As seen from my earlier statements, self-isolation is key. So while we are lifting restrictions on self-isolation for those fully vaccinated, we are enhancing self-isolation rules for those who are not. Self-isolation has been a key part in keeping us safe this past year, and it's been a critical part in our journey while we began to roll out vaccines. I have been recommending for some weeks now that self-isolation after travel outside Yukon, but within Canada, should take place in one of 2 ways. Either the travelers should isolate at home alone, or if their hosts stay in the household, all must self-isolate together. I strongly encourage returning travelers to follow, therefore, one of my recommended options below. Option 1 is to self-isolate alone or with your travel companion in a place that is not shared by others. So that means you will need to find accommodation in a hotel, a separate legal suite, vacation home, or an Airbnb that allows you to safely isolate alone. Or option 2, is to self-isolate in a shared space where all household members will also be required to self-isolate for 14 days. This means that even if you are planning to self-isolate in a separate bedroom, all other members of the household must self-isolate as well. But there is one important exception for this option. If you choose option 2, any fully vaccinated household members who have not traveled will not be required to self-isolate. They can continue to go to work and into the community while the visitors self-isolate in the home. And again, we will have more information and detailed guidance in the coming weeks. Until then, self-isolation remains mandatory as per usual for all parties, with strong recommendations in place from the weeks previous as per the guidance above. And incoming travelers who are fully vaccinated must still, at the moment, isolate for the 14-day period until the transition date of May 25th. It's certainly distressing to see not one, but both of our northern neighbours facing a surge in cases after many months of limited exposure and cases. We Yukoners are fortunate and in a unique position in Canada, but our situation could still change quickly despite our growing vaccine uptake, as long as we have significant numbers of people still susceptible to COVID infection. I know there has been lots of concern surrounding the recent school-related outbreak in Yellowknife. We are keeping in touch with our partners there and keeping a watchful eye on the ongoing outbreak. Are there lessons for us here? Well, our schools have done well all year with well-established protocols and practices. We do know that the newer variant strains can spread more easily amongst school children. So especially as we approach year's end and recognize that teachers, students, and support staff alike are all tired, that we must continue to adhere to the rules and the guidelines. It is critical that people, including children who are supposed to be isolating because of travel, or as cases or contacts, must not attend school, or work or mix in any public setting. In addition, any child with symptoms should stay out of the school and get tested, or use the traffic light guidance to know when it is safe to return to the school setting. To minimize the outbreak potential posed by any one case, all schools should be adhering to health and safety guidelines, including mask use in common areas, hand washing, and physical distancing. As summer approaches, windows can be opened more and more to increase ventilation, and more time can be spent outdoors. As far as Canada's situation goes, case activity remains high, but there are areas where the infection numbers are leveling off. Currently in British Columbia, the number of average cases per day was at its lowest level since the end of March, as the latest round of restrictions are bringing the third wave of the pandemic gradually under control. And Canada's vaccine curve is now surging ahead, with millions of doses on the way. This is great news. But again, as we know, this virus will try to strike anywhere where it sees a point of entry. Let's not forget that we're still not, as a population, completely immune to this virus. It's great indeed to see the growing pace of vaccination in Canada, with promise that the rest of the country will soon catch up to Yukon in the coming months. I'm sure some of you have begun to hear stories from family members and friends who are booking their first appointments or who have received their first, and a lucky few, even their second dose. I know for me, this brings a sense of anticipation that has been hard to find over these past few months. As of yesterday, we had administered just under 26,000 first doses and over 22,500 second doses. We continue administering vaccines within communities through our rural health centres. We will no longer be sending out mobile teams to the communities, but will be scheduling appointments through the health centres and immunizing when we reach a certain number of requested appointments. If you reside within a community and have yet to receive your first or second dose, you're not too late. Please visit yukon.ca to find your local rural health centre phone number where they will help you book your vaccine appointment. I can't stress the importance of receiving both shots to be fully protected. While one shot helps, it will not last and does not provide the strength of protection that 2 doses offer. The second shot is often the one that you will feel more, so be prepared, ideally with a rest day the next day. But please don't let that inconvenience get in the way of getting full protection from your second shot. You may be wondering where we currently stand in our vaccination progress. What follows is I'll give the percentage of individuals in each age group who have received their first dose of vaccines, and we are doing better. Well done, especially to younger Yukon adults who are catching up on their elders. As of the end of last week, our numbers are by percentage of eligible adults. In the 18 to 29 first dose uptake, now 60%. 30 to 39, 69%. 40 to 49, 73% first dose uptake. 50 to 59, 75% first dose uptake. 60 to 69, 83%. And the 70 plus have now reached 90% first dose uptake and 87% second dose uptake. On another positive note, as the Premier noted, as of May 25th, we will see further changes. Bars and restaurants will be able to resume full capacity, increasing the number of tables and patrons allowed in the premises. Now, this does not mean that dancing and hanging out in common areas will be reintroduced. We're not there yet, but we do look forward to further changes ahead if we manage well these first steps. Spacing requirements at bars and counters will also not change for now. After arriving at a restaurant, you will still be required to stay at your table. We still need to be cautious, knowing all too well that these could turn into less than desirable situations if not handled and monitored correctly. I recognize that many businesses have been requesting changes and have had to show great resilience and adaptability. As the Premier mentioned, I agree with that Yukon restaurants and bars have done a fantastic job in maintaining safe environments throughout this past year. And I'm keen to give them a chance to welcome more people in and to make the businesses a little bit more viable. I hope that this news provides a bit of relief to these establishments and shows Yukoners we're moving forward and are slowly starting to see COVID-19 fade into the background. Now, for some of you, these updates may not answer all of your questions or concerns. And for those who have lingering questions that you may have not gotten the answers to, I invite Yukoners to take part this Saturday morning in a live Q&A event with myself and Canada's Chief Public Health Officer, Dr. Theresa Tam. Not to mention that one of everyone's favorite Yukoners, Gurdeep Pandher, will be moderating the conversation. We will be taking questions ahead of time. If you have a question, please feel free to message us via Facebook or by email at hss@yukon.ca. There'll also be an opportunity to ask a live question to either Dr. Tam or me during the event. The event will take place at 10 a.m. on Saturday, so keep an eye out for any social media posts or head over to the Health and Social Services Facebook page where you can find the link to register for the event. So you are welcome to participate in this unique opportunity to speak with one of Canada's leading health professionals and to have your questions about COVID-19 and vaccination heard and answered. And I have to thank Gurdeep for his inspiration to put on this event. To end on an important note, as the Premier talked about, it's Mental Health Week, and Yukoners can get ready to hashtag get real about how you feel. And this year's theme is all about tuning into how we're feeling and naming it. We know from Yukon's own well-being survey that the pandemic has brought more challenges to Yukoners' mental health. For example, Over 1/5 of survey respondents of the well-being survey that we administered in August 2020, over 1/5 of those respondents reported most days since the pandemic were quite or extremely stressful. Almost half of survey respondents reported negative impacts because of someone else's mental health issues during the pandemic. And negative mental health impacts were generally more likely to be reported among females and in some cases transgender individuals than among males, and among younger age groups than among older age groups. And this is consistent with other survey results that we've seen across Canada related to the pandemic. Especially during these times of uncertainty, change, high stress, and isolation, it's normal to feel worried, unsure, lonely, moody, and depressed. Good mental health does not necessarily mean feeling happy every day. We're encouraging you to embrace all of your emotions and get real about how you're feeling. You could begin by taking a few seconds during the day to check in with yourself and ask yourself, what am I feeling right now? And what words and thoughts go through your head in those few seconds? If you need support with your mental wellness or substance use issues, there are many resources available in Yukon to help. And please use these services whenever you need and from wherever you are in Yukon. And that's it for today. Stay hopeful, stay well, take care of each other. Thank you, merci, Gonestish, masicho.
Thank you, Dr. Hanley. Thank you, Premier Silver. I'd like to go now to reporters, and we'll begin with Jackie from CBC.
Hello. We heard that the NWT is introducing Pfizer shots for teens. I'm wondering if the Yukon is going to be doing that or is considering it, and if so, what are some of the logistics? I know, for example, that we chose Moderna because we couldn't store Pfizer originally. No? I'll let you speak to that.
So with Pfizer, we've always said that Whitehorse was definitely ready, willing, and able to do Pfizer from the beginning. It would have been harder to transport Pfizer because of the fragility of the vaccine into some rural communities. But Canada made a decision to go with Moderna, which we were thankful for because we were front-end loaded with the 75% of our adult population. I'll let Dr. Hanley, he probably has more information on the Northwest Territories and what they're doing with Pfizer. But I will say that at the last conversation we had at the First Minister's meeting with all the premiers and the Prime Minister, we talked about how proud we were of Yukoners and the vaccination rate that we have in Yukon, and that we are ready, willing, and able to take on Pfizer as we see these results being ahead of, these trials being ahead of Moderna and other vaccines. So the message to Ottawa is bring it on.
Yeah, I can certainly add a few words to that. It clearly is something we've been keeping a watch on, and it's this kind of ongoing conversation between where is Moderna going to follow. In an ideal world, operationally, it would be an advantage for us to stick with Moderna, because we've done it all over Yukon now. We know the approach. We've got the training. We've got trained people to do it, and we do anticipate that Moderna will not be far behind Pfizer, and will likely be in time for when the ideal time to vaccinate our children will be anyway. But we're looking at all the options. It's great news that Pfizer has come through and that Canada is, I think, the first country to have this regulatory approval. So we're in a really good place. We're as a country, but in Canada, in Yukon, we're in a pretty stable place. So we can take our time to consider what's going to work the best. I can't wait to have my kids vaccinated, but I want it to be done, with the right product at the right time. So we're really just looking at all the options, taking some counts, and figuring out how we would do it with either one product or the other.
Do you have a follow-up, Jackie?
I do. This is in regards to the upcoming fire and flood season. I'm wondering if firefighters, if they need to be called in from outside, will get any exemptions for self-isolation if they are not fully vaccinated.
Yeah, well, I can say a couple of things to that. One is, of course, we do already have we have a number of processes in place to accommodate people, whether they are critical or essential. So, for instance, essential workers through our alternate self-isolation plan program, critical workers who are exempt from the self-isolation, but do have an understanding and a requirement that they observe self-isolation when not at work and have safety protocols in work. So regardless of the vaccination, we already have ways to accommodate people who are critical workers. And clearly, if we were in a wildfire situation needing outside workers, we would be we would be making allowances for them to work in a safe way without having to do that 2 week of self-isolation, because we've already done that many times. Yeah, the other. Of course, the picture is changing rapidly in Canada. Many first responders have already had the opportunities to be vaccinated. It could easily be that many of them have had their first doses already, and so there will definitely be probably a number of ways to accommodate that need. And if we're looking at an extended stay, if it works out from a practical point of view, we would also be able to offer vaccine to people, as we have to other people coming in on rotational schedules.
Thank you. We'll move now to Haley, Yukon News.
Hi, thank you. Exciting news. My question was more of a clarification. I wasn't sure I understood correctly. The need not to self-isolate anymore. Does that just apply to Yukoners who are returning, or is that all Canadians who've been fully vaccinated coming to the Yukon?
Yeah, I can take a stab at that. Good question, Haley. So it does apply to all Canadians who are able to show that documentation. Practically speaking, this is really aimed at Yukoners. But without from a practical point of view, it's going to be easier to phase in Yukoners, let's put it that way, because we know that the verification process for Yukoners is going to be a lot easier to carry out. But it does not exclude Canadians who can also provide certification of vaccination. Canadians, as we know, there are not that many Canadians outside of the territories who have had that opportunity to have their second dose. So that's why, on a practical level, proportionately, this applies more to Yukoners than to non-Yukon Canadians. But we are rapidly working out how we would carry out that certification process. As you know, there are also federal efforts to do the same, and so we will get there. And we know that more and more in the weeks to come, Canadians will have had their second dose and be considered in that fully vaccinated category. So we will get there, but practically speaking, I think we're really seeing this as an opportunity, first and foremost, for Yukoners, but eventually to all Canadians with that similar status.
Premier Silver?
Yeah, I completely agree. I think right now it's very obvious that if a Yukoner was coming back to Yukon and could basically sign a waiver or sign a declaration saying that you can access this part of my health record, because we've done such great work over the last 4 years to modernize the health system here in Yukon, we have that ability to do that for Yukoners right now. We will be working with other jurisdictions to see how that works for other jurisdictions. But again, we are ahead of the curve, not only with our vaccinations, but also with our data sharing and abilities with Yukon, with the HSS, Health and Social Services. So it is good news for all vaccinated Canadians. It is the logistical piece that we'll be having to work out in the upcoming weeks, as far as people from other jurisdictions and what that means. Now, back to another point that Dr. Hanley did make, that other jurisdictions are saying right now, please do not travel. So that we do also have to respect other jurisdictions' guidelines as well as we move forward.
Thank you. Haley, do you have a second question?
Thank you. I do have a second question. I think this one would be more for Premier Silver. About a month ago, it had been mentioned that at the First Minister's meeting, the idea of eventually opening up the border with Alaska had been brought up. I'm wondering if there's a status update on that. I know they're still reaching higher numbers of vaccination, but is that a possibility we might see, that Alaska will open before the southern border?
I don't think that the federal government has ever considered regional. It's never been something that they've considered that they would do a case-by-case basis, but we have seen the anecdotal information of special cases. I have made known to the federal government as well how closely connected we are to the beautiful brogue of Skagway, for example, and how much connections we have to friends and family there. But at the same time, on a much larger scale, we have jurisdictions like Ontario saying, please shut down Pearson International Airport. And then the conversation goes over to BC, which we really are, lockstep with as far as borders, and how important it is to make sure that, the federal government has a consistent message when it comes to how they are going to apply that to all of America and all of the other countries. I don't see a lot of forward progression on that conversation since the last time that we talked about it here at this table. And if anything, the conversation is now switching to the larger jurisdictions that are seeing much more problematic pathway forward to opening up to America.
Thank you. We'll move now to Luke, CKRW.
Thank you. This is probably a question for both Premier Silver and Dr. Hanley. I'm wondering what you would say to families who have children who obviously aren't eligible to get vaccinated, who might be feeling frustrated by the fact that they can't take a trip, at least in the next couple months, because their kids aren't vaccinated. They can't take a trip without quarantining.
I would say what we've been saying for the last several months of this pandemic. We need patience, and we need to make sure that we're doing things for the safety of all Yukoners. And I would also say that we're in a very lucky place here in the Yukon. But that luck didn't just come by chance. It came from the due diligence of Yukoners, the amazing work that Health and Social Services has done, and also the Chief Medical Officer and his team as well. We are leading Canada in a lot of pursuits, I would tell these families, and I would say that there is a brightness ahead, and we still need people to remain vigilant at home, and that's what's going to keep us safe. But again, there's good news on the horizon for folks.
Dr. Hanley?
Yeah, I would completely echo that. And I could understand why parents might feel, well, what about us when we have small kids? But think of this as a phase one, and this is a big step, I could tell you, not just for Yukon but for Canada, and so we need to do this with care. And if you can just imagine from a practical standpoint, what are we seeing in Canada? We're seeing surges in COVID activity that are primarily led by newer strains and the variant strains of COVID. And who are these infecting? And we know that the variants, because they are more transmissible, because older adults are increasingly getting vaccinated, we are seeing that younger people are getting proportionately more hit, but also the virus affects children more than the previous traditional COVID virus. So children are affected. I'm not sure. I have kids that are not currently eligible for vaccine. I'm not sure I would be traveling, even if we were welcome in other parts of Canada. I would not be traveling into COVID prevalent areas with my kids. I don't want them to get exposed to COVID, especially variant COVID, and I don't want them to be potential carriers of COVID infection back into Yukon either. So that's just the kind of the reality that there is. And when we have the opportunity to vaccinate our kids, the conversation will be very different. At the same time, we do recognize that that kids often can be close with their parents, not necessarily exposed, depending on the age of the kid, but depending on what the relatives are and what the vaccine status. There are just so many variables here. So we are looking at, are there some intermediate options that we can offer, and doing some further analysis. But the risk is real.
Thank you. Luke, do you have a second question?
Nope, just the one for me. Thank you.
Thank you. We'll move now to Tim, Whitehorse Star.
Hello, can you hear me?
Yes, we can. Please go ahead.
Okay. I guess my question is for either Premier Silver or Dr. Hanley. You went into some description of how this documentation process was going to work. I was just wondering if you could enlarge on that a bit.
Sure, Tim. I can take a look. And again, as the Premier noted, it's going to be quite different from what happens within Yukon versus the rest of Canada, at least for now. And as I said, I think, as you know, the Federal Minister of Health was talking about this not long ago, and I think there is movement at federal level to have more of a uniform certificate of vaccination, and I would look forward to that. In the meantime, we do have a documentation system. We have what constitutes an immunization registry, which is known as the Panorama data system. And in that, when you go and get your shot, if you did, I hope you did, if you go and get your shot, then your vaccine dose and the lot number and the date and all of that gets entered into the Panorama system. So that that information can be accessed, assuming that that we follow consent and privacy rules. That information can be accessed. So if you were coming into the territory from travel outside, and on your declaration you say, yes, I consent to have this information released, then that information can be accessed by healthcare providers and passed on to ensure that the certification is there. So of course there has to be privacy protection processes in place to protect that flow of information. The people who access the Panorama system are healthcare providers, and just that piece of information of vaccine status can be verified. So that is the basics of the system. Clearly, that is an internal system for Yukon residents. It's a part of Health and Social Services. So, for people coming in from another province, we have to have some other way of verifying, which might be just documentation from the center where the person had their immunization. So these are the first steps, and as I say, eventually it would likely be entered into an app, such as the Can Immunize app, where everyone in Canada, when they had their immunization, would be able to have that certification easily available.
Thank you. Do you have a second question, Tim?
Yes, I do. And this again would be for either one of you. I had a reader ask this morning about the checkpoints, such as at Watson Lake, and whether there's going to be any plans on start staffing them again.
Yeah, so as we did announce today in our notes that we are looking at changing the hours at the border. And again, now that it is travel season, in our weekly updates, ECC did talk about an increase in travel. And so the folks at Community Services are monitoring the situation, and we'll definitely make sure that at the borders we have the personnel there necessary for any increase in travel.
Thank you. We'll move now to Amy, Canadian Press.
Hi there. This is a question for Dr. Hanley. I'm wondering how you're factoring in consideration of variants like P1 that we've heard are not as responsive to vaccines, and what happens if you do get a case like that in the territory.
Yeah, thanks. Good question. And just to note that all of our recent cases in the last few weeks have been variants, and this is the expectation. As we go forward, as variants, as particularly the B117 variant becomes increasingly dominant, as it now is in Ontario and will be in BC and other places. That this is what we will see. This is the new COVID. So these decisions were made in the full knowledge of variants and the emerging and ongoing accumulation of evidence around variants and vaccine. The P1, we have also had a P1 variant in the territory. We have, again, the same measures, the same public health measures, the same contact tracing approach were put in place, and as we have shown through our recent case management, we are able to handle variants as well. So I would say the emerging evidence is positive and reassuring regarding the known circulating variants and vaccine. The evidence will get better as we go, but what we see, particularly for the mRNA vaccines, but not exclusively, we see increasing evidence that the vaccines are protective against the variants as well. There may be differences in the test tube, but in real life, it seems those differences may be less significant than what you measure in terms of antibodies, and that clearly the message is that our best weapon against variants is a highly vaccinated population. And I wanted to also point out that one of the other reasons that we know that by incentivizing vaccine, we will be able to reach a higher population uptake. So we know that part of the strategic, I guess, reason behind having waiving self-isolation requirements for fully vaccinated Yukoners is that we expect that we will see those Yukoners who have been holding out or waiting for promise of individual benefit, we will see those coming forward. So the more that we can do to get a higher and higher population uptake, the better we will, as a population, be protected against COVID, no matter what the circulating variants are.
Premier Silver.
Thank you, and I absolutely agree with Dr. Hanley. I would just want to make a general comment when it comes to our modus operandi here in Yukon when it comes to lifting restrictions. There's always a number of factors, always, including vaccine uptake, as the doctor talked about, but also case count, as he's talked about, as well as the spread of variants. Always important, not only variants here, but also in other jurisdictions. Bottom line is, whether it's bubbling, whether it's schools, whether it's lifting restrictions in general, epidemiology is the primary factor, and we'll continue to follow the recommendations of Dr. Hanley.
Thank you. Amy, do you have a second question?
Yes. I'm just wondering why it's happening May 25th. I'm curious, do you need a certain level of fully vaccinated people? And if so, what's your kind of estimate for percentage at that stage?
The data is more about the recommendation. So again, as we've done in the past year, the political side of the government it does not get in the way of recommendations. We're at a place right now where, based upon science, we're making recommendations, and whether it is returning to full-time classrooms or bubbling with British Columbia or any other consideration, that information is getting out as the recommendation is salient. We always then have time, and we usually try to do a 3-week window where we now prepare based upon the recommendation. We said with the school system, going back to full-time classes, this is the recommendation. Now let's see what's physically possible. And, a credit to the schools, the administration, the parents and teachers to get us to where we need to be based upon the recommendations. So very similar here. We're taking a look at enough time from the recommendation to the physical reality of implementation.
Thank you. We'll move to Laura Boreal.
Oui, merci. Je me demandais, est-ce qu'il y aura une vérification de quand la deuxième dose du vaccin a été administrée pour s'assurer qu'une personne qui revient au territoire l'a reçu il y a au moins 2 semaines.
So, will there be any kind of verification of when someone would have received the second dose to make sure that there is at least 2 weeks in between the return?
Oui, merci pour la question. Oui, le temps, c'est important, en fait, la période de temps entre avoir reçu la deuxième dose et la confiance de déclarer qu'on est protégé, vacciné, c'est 2 semaines. Donc c'est une partie, c'est de vérifier la date pour vérifier que c'est au moins 2 semaines après la deuxième dose.
Avez-vous une autre question, Laurie?
Oui, je regardais le Path Forward sur le site du Yukon et je me demandais si on pouvait aussi s'attendre à des nouvelles mesures bientôt concernant le télétravail.
So I was consulting the Path Forward document, and I was wondering if we can expect any new directives in terms of return to work.
Oui, pour on peut dire que le but c'est pour avoir toutes les personnes qui veut d'avoir la possibilité de travailler sur la place, mais sur place et maintenant les mesures c'est pas on est peut-être entre les deux positions. C'est plus un point maintenant de pratique. On a tous les moyens en place d'adapter aux gens qui travaillent à la maison, mais c'est plutôt selon les employeurs pour décider ce qui marche le meilleur. Éventuellement, j'imagine on va arriver à un système où on a les personnes qui continuent de travailler à la maison, peut-être pour les raisons de travail, pour les raisons de succès de lieu de travail. Donc il n'y a pas une limite forte à ce moment de travail, de lieu de travail. C'est plutôt pour une considération pour les employeurs et les employés. I'll just say, the question is about working at home. I would say right now we have kind of a hybrid version where we still have many people working at home, and we have, I'd say, for most employers and employees, quite stable arrangements. So I don't see that we need to really declare one way or the other. I think it'll be a kind of a natural movement as we open up for people to find their right place. And I can imagine work at home arrangements to be in some way the way of the future, according to how well it works for the place of work, for the employer and the employees. So rather than a sort of a hard call out for everyone to return to work, it's more of adapting as we go forward to what works the best. What are the current space arrangements? How will the physical distancing be accommodated? What about mask use? So really, as long as all the work safe measures can be adhered to, it's up to employers and employees to determine who works at home and who's at the workplace.
We'll move now to Vincent, Radio-Canada.
Oui, bonjour, Dr. Hanley. Une question sur la vaccination des plus jeunes au territoire du Nord-Ouest. Je voulais savoir quel était votre regard sur cette situation. Est-ce que c'est quelque chose que vous considériez faire ici, la vaccination des plus jeunes?
So the question is about the Northwest Territory program to vaccinate youth. What is your position on this, and are you considering the possibility of doing it in the Yukon?
Oui, comme on a expliqué tantôt, on a ce point de vue depuis longtemps. On a projeté éventuellement de vacciner les jeunes. Maintenant, à partir d'aujourd'hui, le vaccin Pfizer a reçu l'approbation pour les âges 12 à 15, donc 12 à 17. Et on sait que Moderna n'est pas loin dans les semaines, peut-être dans les 2 mois ou plus ou moins pour venir, on va entendre nouvelles de Moderna. Donc, pour nous, c'est une question de... pour nous, c'est un avantage si on peut continuer avec Moderna parce qu'on a tout l'entraînement, tous les logistiques pour Moderna. Si ça arrive en temps pour faire un programme pour les jeunes pendant l'été, ça sera mieux pour nous, mais si il y a un délai significatif entre Pfizer et Moderna, on va voir toutes les options aussi pour recevoir le Pfizer, la formation qu'on aura besoin, les logistiques pour aller dans les centres ruraux, tout ça. Donc, tout est sur la table pour le moment. On voit avec intérêt les prochaines étapes avec Moderna et les possibilités les options pour si on considère Pfizer comme produit alternatif.
Avez-vous une autre question, Vincent?
Oui, s'il vous plaît. La deuxième question, c'est il y a 2 semaines, vous nous disiez que le succès de la campagne de vaccination, ça ne voulait pas dire qu'on allait rouvrir les frontières avec la peur des variants. Alors, je voulais juste voir qu'est-ce qui a motivé le fait d'alléger finalement les restrictions et ces mesures-là qui vont avec à partir du 25 mai.
So 2 weeks ago, you said that it's not because vaccination was going, not necessarily because vaccination is going well, that you would have lesser restrictions or that you would change your take. So what exactly is motivating you right now to look into May 25th as a date to modify this take that you have?
Sure.
I wouldn't say that was necessarily the message last week. I think the question last week was 75% as being the marker, and I think again Dr. Hanley has been very good over the months of describing that as being what we assumed through the national immunization folks, the willing participants in a region. So just quantify. I hope that clears up, what we were talking about as far as 75%. We always were very interested in getting to a herd immunity, for the record.
Oui, merci. Et c'est peut-être pour dire qu'on voit la taux de vaccination, oui, mais on voit plusieurs facteurs au même temps. Par exemple, le taux d'activité de COVID ici, le taux d'activité de COVID ailleurs, la coopération du public avec les mesures de santé publique et l'évidence qui accumule de la protection de vaccins contre COVID et même pour la maladie symptomatique et asymptomatique. Donc, on voit avec plus et plus confiance que les vaccins sont énormément protectifs contre le COVID et même le COVID sans symptômes. Donc, on est plus en plus confiant de la protection des vaccins, même avec les variants et avec l'habilité de empêcher la propagation de COVID en même temps. Et comme j'ai expliqué avant aussi, c'est que on sait que il y a des individuels qui attendent qui sont peut-être en attendant. Pourquoi est-ce que qu'est-ce que c'est de le vaccin pour moi? Et si on peut donner un retour, un incentive pour recevoir le vaccin, ça va contribuer pour nous d'augmenter la taux de vaccination dans la population et qui va au retour protéger toute la population. Donc, c'est aussi une stratégie pour encourager les gens de se vacciner pour protéger toute la territoire éventuellement. Donc, c'est plusieurs raisons, plusieurs facteurs toujours. Et j'ai beaucoup de confiance de la protection de vaccins que maintenant c'est le temps de faire cette prochaine étape.
Thank you. I'd like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, May 12th at 10:30 a.m.